For today, we're going to dive specifically into a question we're getting so often right now, which is about the philanthropic priorities. Where are people's giving priorities? What should we be pushing or not pushing? How do we align our focus on priorities with the current marketplace, capturing both the donor expense perspective and the organizational perspective? Before we do that, just a few housekeeping items. And as we go through that, I'm going to jump back actually up to here, is first of all, please do use the Q&A feature to ask us questions. I think that's really important that you use the QA function and not the chat, because we can capture those Q&A questions for getting back to you later. So please use the Q&A function. Any of the other unanswered questions, we're going to get back to you somehow if we can address them on the air. And please share your thoughts with us. Feel free to use a hashtag BWF webinar to chat in the Twitter sphere. If you have technical challenges, hopefully we have no more of those than this late start and restart, but please email bwf@bwf.com. We have people monitoring that to really help you with the technical needs. And that should also have been in your email. So for those of you thinking, yeah, if they're technical, how are they hearing this announcement? It's out there as well. So please, if something comes up for you all on the line, bwf@bwf.com. Know that we have several other webinars coming up. The one that's most imminent is Thursday, April 2nd, tomorrow, where we're really going to dig in how do you measure engagement and people's level of engagement and being priming your organization for future state. There's some questions. Are people less engaged, more engaged? How do you test that, find that out? I think it's going to be a really captivating, interesting session by your host, Alex Oftley, who leads BWF's Data and Decision Sciences area. So Mark and myself, I'm the CEO of BWF. Mark is President of BWF. We're really excited to join all of you. It's such a privilege and an honor to be serving this community, a community that we all benefit from at this important time. And what I'm going to do is I'm going to turn over to Mark to really start talking about the philanthropic priorities in alignment with the current marketplace. Before I do that, just quickly on the agenda, Mark is going to talk us through really working with the donors to establish priorities. I'm going to take sort of a perspective on, from an organization, what can we do in shifting priorities according to marketplace recovery stages. We're going to try to cover it from many angles. We're going to try to dive in and leave some space with questions. With the later start, once again, we will get back to your questions. So please don't use that as a reason to hesitate from asking us for questions. We do want to hear from you, and we learn so much from your perspectives. So with that, I'm going to turn it over to Mark Marshall.
Great. Just a reminder, thanks, Josh. One of that we really, as we think about this, we think about when we've had economic and social disturbances or disruptions before, the keys that we're driving through people is consistency. We've heard from donors over time that the importance about staying focused on the ability to stay engaged, be consistent about the role of philanthropy. Take the long view. Warren Buffett had a great quote the other day about that it has the economy, the outlook on the economy for America over the next 10 or 20 years really changed significantly. And the answer is really probably not, or a hard no. We know that during these time periods, donors step up in ways that we never anticipated them to. We've seen some great gifts to some of our great hospitals in America. And then finally, that our missions matter. The mission of every place that you all work for matters more during these periods than ever before. So these times matter. Okay, we're going to jump into today's comments. If we move forward, Josh. All right, so I wanted to talk about working with donors to establish priorities, and let's just jump right down in our slide and keep us moving here in the interest of time. I wanted to remind you all, this is from Giving USA. It reminds us where all those dollars went. And there are many of us who, one of the proud points of the firm is that we work broadly across all these different sectors. But what's important is many of you may support many different areas of the Giving USA chart when we look at where dollars could be given. But what's important is this is not just broad categories, but for each and every donor out there, one of these categories represents their most important priority. While certainly religion has long held that space, For some people, education is the #1 giving priority. For other people, it's the environment. For others, it's the arts and humanities and culture. For other places, it might be a social service or a public society benefit. But this is really about seeing that each person's priority is different. So while your organization may not be the top priority for 10 people in town, there's 2 people in town that it may be the #1 priority every single time. That's the important part that we need to think about as we head into this economic disruption. Next slide, please, Josh. So think about what's the role of our current philanthropic priorities. First of all, are they tied to our mission? But what those current priorities may be shifting based on your organization's business model. So for example, for some of you, strategic vision still matters. We did some work with a great college that was important that they rebuild their science center. Most of the science centers were built in the 60s. They're all now 40, 50 years old. It was important to their strategic vision for the institution. For others, right now, the philanthropic priorities are shifting to survival dollars. Some of the arts organizations that are heavily, or museums that are heavily attendance driven, right now, the most important thing they can do is make sure they can keep their operation moving forward. They can retain their staff and take care of their performers and artists and staff members, while other organizations are now extending their mission. While they may be raising money in a healthcare space, it may not be that traditional healthcare dollar that they're raising, but really to support care workers or impact related to the COVID crisis. And then there's going to be other priorities that fall outside of all those, but really taking stock about where your priorities are and how have they maybe shifted over time is going to be important on almost maybe a daily basis, but certainly doing it every few weeks to see which are our philanthropic priorities and how can we have the greatest impact on our mission. Let's jump to the next slide, Josh. So what's the impact of our priority? So one of the things to be thinking about is as you're thinking about your philanthropic priorities, what will or will not happen in the world? We need to think about this not as a daily disruption, but what might the impact be over the next few months or a year or two? We know we've learned things from the 9/11 crisis, and we know we learned things from the economic downturn in 2008 through 2012, that there were some significant learnings. But what didn't matter, it didn't change, was that at the end of the day, it was still important to do things like protect our environment. Classrooms didn't get any newer by not being renovated, and that the ability to impact what we were doing to discover new cures. Certain priorities were more important to other people. For example, healthcare was less impacted during the down economy because it was still important. If you cared about, if you had a family member with cancer, cancer care or cancer research was the most important thing for 2008, 9, and 10 because that was important to your family. These are going to be different for every single donor we deal with. And it's going to be important to understand what is our pulling back or moving forward with campaigns, fundraising initiatives, donor engagement, what's going to happen or not happen because of what we're doing. What will our lack of ability to raise dollars do to our ability to impact our mission? Many nonprofits are heavily driven by their philanthropic revenue, or it may be their only revenue. Really understanding what that impact is going to be important. Next slide, please. So one of the things we really want you to do is really take a look at your current case. How are you talking about yourself? I get to spend a lot of my time around academic medicine, and I would tell you that the question that is most challenging for donors, even donors to complex medical centers, will tell you they don't actually understand what academic medicine is. If you've been watching the news the last few weeks, they've talked a lot about the role of our academic medical centers. So if we thought about it, how important academic medicine is today than it was viewed a month or two ago, or our great community hospitals. The idea of something as simple as enjoying a concert in person I didn't think I would care about it as much as I do today. I would like to be able to go to a concert. Many of us would. And those people in particular who love the arts, who are passionate about it, know that being able to sit in a music hall and listen to the impact of that music is going to be, they're looking forward to that again, and they want to do that. And it means that making sure that a great organization is there for them on the other end is going to be important. Additionally, having classroom experiences. How we talk about this is going to change significantly. We're gaining a respect for certain things that we maybe didn't have properly before. And we're also going to need critical needs. Josh mentioned on the front end that critical needs is looking differently. There is an ability for our great nonprofits to really partner with the government, and how do we help deliver some of those services. All of those things are going to be important for really reevaluating our case and how we're impacting the community. Next slide, please. So as you're thinking about your refined priorities, you may want to shift what's at the forefront, but want to encourage you as you're sitting down with donors to make sure we're listening. We need to be in listening mode for what our donors are saying is important to them, or how they're, as individuals, handling this disruption and how it's impacting their family. Some individuals will be better donors because of the disruption than they would have been without it. They may actually financially be in stronger positions because of the disruption. Not that they wished for that, but it may be a outcome that is surprisingly beneficial for them. Be clear about the role of philanthropy at our organization. Are we survival dollars? Are we value added dollars? What's the impact of what we do? How we talk about philanthropy over the coming weeks and months is going to matter with donors more than ever before. We want to make sure we're not tone deaf to what's their crisis that they're dealing with as an individual family, or what's the disruption to their business or to other organizations that they care about. But talking about this in a genuine way is going to be significant. Thinking about shifting the order of urgency for our organization might matter. So what are the priorities that we might be bringing to the forefront? If you're a hospital, taking care of care providers during this time period and taking care of families that are bearing an additional burden as they're caring for loved ones may matter a great deal, but those may not shift for the donor. They may still care greatly about cancer research. Or if you're an individual who cares about your alma mater, them continuing to build out their science center may matter more than immediate relief for scholarship recipients. Maintain the focus on your priorities. Keep focused on the priorities, keep focused on your donors, and keep the philanthropic conversation moving forward. Your donors will tell you everything you need to know if you just will take a moment and listen to them. With that in mind, I'm going to hand this over to Josh and come back for questions.
All right. Thank you so much, Mark. And it was a really good point, the listening too. That really stuck with me, because really every donor is in their own specific situation, and we don't know where they really are. And yes, please do use the Q&A to ask questions. We certainly welcome those. With our later start, if we don't have time to get to those, I do promise that we will get back to you on those. Now, I'm going to shift gears a little bit to shifting priorities by marketplace recovery stages. Because there's not a here's what we should do full stop. It's what do we do now? What do we do soon after? What do we do long term? And perhaps the long term, even now we need to be thinking about that, so we're not in a consistent mode of urgency around our planning and organization. So I broke this up in a few ways. And now certainly where I wanted to start was that short-term focus. Now this is where we know, I mean, we've had our extreme disruption for most of us. Most of our donors have as well. And as I mentioned in our first client series webinar, there's been a knocking down of the Maslow's hierarchy down to the physiological and safety. Once people have established food and safety, then they usually move towards looking for love and belonging, connection. I think collectively that's where our culture is right now, with that being deprived of us. The focus on finding relationships with others in a strained environment is really important. And most of philanthropy is from that point up, with esteem and self-actualization. Now, some of the donors might be further along this journey than others, and that's partly the reason why we want to listen. Now, this is from their perspective, but also organizationally, there are donors that want to give at times of a knockdown and in crisis management to those urgent needs that are what I call recipient benefit type gifts. So to those that are hurting immediate relief, where some donors move very quickly towards big systemic solutioning, perhaps big research gifts or gifts to solving the problem. That's usually a later stage. So urgent needs, opportunities to help, recipient benefit are where most people's minds are. You might find some donors starting to shift towards what I'd call situational solutions. Can we help do some solving that benefits more? As we know, the high net worth often responds well to ripple effect or systemic impact level gifts. They might be looking for impact level beyond direct recipient benefit. So some of that short-term focus is already starting to evolve. And as we know, regardless of message, when we're in the short term, that gratitude needs to really be pronounced. I know from just seeing all of your, so many of your posting, your social media pages, some of the appeals that you've sent out, you've been really a wonderful community. I'm just so proud of the nonprofit sector and to be a part of it, because I've seen so much gratitude, some thankfulness, some asking people how they're helping right now, celebrating these selfless donors for their contribution, not necessarily to their organization, but the type of people that give you money are the type of people that do amazing things. They're the helpers in this. One specific message that's important is for those that have given to you in ways that have enabled sustainability. For example, an endowment gift or giving towards quote unquote rainy day funds or giving towards kind of the future of organization. You're existing right now because of those gifts, especially thinking those donors. In some crises, people question endowments. This is one of the moments where endowments show how important they are when we've got reserve funds, for example. Thank the donors that are continuing to give through this, how special that is. But also now acknowledge, as we discussed in the communication session, is some donors actually will feel embarrassed that they're not where they were able to give before. Make them feel welcome, and even if they're not in that situation. Because so many of us, especially if we're big donors or we've given before, we feel bad that we can't help. And I think that's an especially important time, because they'll recover. Most people will recover. I'm choosing to believe that, and you'll be better off if they really feel that you were there for them at this moment. Now, this is what we know, but I'm getting more questions now. All right, early recovery. What are some learnings from the past for what should we be doing? Chapter 2. What's the class 201 on recovery from a priority perspective? As Mark mentioned, some constituents are doing well despite everything. We are getting plenty of stories. I've some in healthcare, some in retail, specifically grocery, some stories I've had with some of you on this very broadcast about big gifts that have come in really because organizations are profiting well from this, and I don't want to say they feel unfair about it, but I'd say they, in a very wonderful way, they're saying we want to share this for others that are not doing well. So we're specifically seeing some examples of generous corporate giving in a few targeted sectors. Now, many are not. I don't want to say most people are giving generously, but I'm just saying there are stories of that. There are hope. There are bright lights out there. There are bright spots. If I'm quoting Jerry Sternan of the Positive Eating School, there's points of positive deviance. What we'll see is, and what we've seen in other Black Swan events, we've only had 2 that are often referenced in webinars like these with the Great Recession and 9/11. But in both of those cases, which we're assuming will be the case, is that higher level donors will shift to other priorities sooner than the base will. So be prepared for that shift being a top-down shifting of priorities. Foundations will often lag. We are seeing some examples of increasing unrestricted portions. Others, I am seeing some holding off already in anticipation, but because of the rolling, oftentimes we see a little bit longer recovery from foundations as they acclimate to the economic realities. Now, during the immediate recovery, I'm really looking for champions at this point. Who will jump first? And maybe it's because I have 3 teenage daughters. I've had to watch that show Divergence, where the one brave cadet or trainee was the first to jump into this, what looked like a bottomless pit, but ended up being a net at the bottom. But they didn't know that. And it was a test of bravery to see who will jump first. You're going to have champions that can be leaders as donors and volunteers, even those that have already stepped up. Make a good point of those in chapter 2, those recovery gifts, some volunteer reach outs, perhaps even some matching gift opportunities to kind of get things going again. So champions would be one area. With the solicitations specifically, I would just moderate your expectations. I would expect a slowing in multi-year. That doesn't mean that you should lead the donors away from those. Leave them the space and listen to where they are, but don't have high expectations. You're going to get a lot of multi-year commitments right now. Mark, did you
Josh,
want
there's
to?
a brief question about how aggressive should people be on solicitations during this time?
Yeah, it's a really good question. And what I've counseled folks on is that I would be aggressive in caring, but reactive in solicitation. And what I mean by that is everyone is at home right now and immensely reachable. We have no excuse to not try to reach out and see how everybody is and have a dialogue. Through that dialogue, I think that the donor's conversation will lead you to their readiness and whether we should discuss that. But so really with the major donors, this is an N of 1 conversation. I think for our other donors, our base, I would view that as giving an opportunity to help. So it's a little bit different than you must give, or please, you should never use obligation type messaging. But more importantly now, some people just want to help, and it's a service to give people ways to help. That's not only financial, but maybe ways to help are to give towards this specific urgent issue. It's a way to volunteer in this way to give that opportunity. So I would recommend pulling back on the heavy solicitation metric in terms of proactive solicitations, but not slow down in my contacts. In fact, I would try to focus on my contacts to learn whether this person is someone that we should cautiously enter into solicitation talk. Because of the increased volume of people you're reaching, you might actually maintain a similar volume because of your reach is better with people being at home and easier to schedule. That's my short answer. I'll think more about that in the written response. I'd also suggest showing pledge flexibility. Someone with people who are in pledges or are about to commit a pledge, seeing if they're willing to just offer the cash equivalent now if they're hesitating, and then continue with the full pledge next year so that it's a written commitment later. I'm hearing some talking about contingency or conditional pledges. And some are cautious about this, but I would evaluate this as an organization. With some donors, when your stock price is back up, or would you be willing to give a gift when your stock price gets up to this level or when you're back to normal? But if we're not up to normal, we totally understand. So a conditional, but really to keep movement going along that dialogue towards solicitation. Being flexible in time periods for payment, thinking more creatively around multi-asset construction, while at the same time being careful with bequest messaging. That is not selling right now. Don't tell people this is a good time to update their will. It will be deaf ears and it'll come back to bite you. So I would, unless they bring it up, that's when I'd especially be reactive to. As we're shifting to long-term, we should be starting to think about, even now, how do we establish our business continuity plans for future Black Swan events? What did we learn from this in terms of continuity? Now, this is an unprecedented situation, but there's something that happens every once in a while through our lifetime. Just that we have reference points that this is the third many of us talk about in our fundraising career. There's certainly been others, perhaps not this extensive, but to some, the Madoff situation decimated the charity as much as this has for some. Consider specific continuity-based funds that might resonate after this. Reframe the importance of endowment and unrestricted commitments for future scenarios. I was in a board meeting, an organization where I give to, where the chief development officer asked us really to give where our minds were right now. And I talked about my own personal giving. And I said, I know a lot of people are focusing on the urgent needs, but frankly, where my head is the continuity of this charity. I believe in what you do. I want to give so that this organization continues. There's some donors that are focused on continuity as well as the urgent needs at the recipient level. So that's the importance of commitments for future scenarios. But also be mindful that there are lasting effects even beyond our fundraising environment right now. When we analyze certain campuses that had extensive protest events during the Vietnam era, the classes the year before and the year after had much higher lifetime values than the senior class of when those disruptive events happened. We're expecting likely a lifetime value hit on the class of 2020 alumni. They're going to have a different nostalgia experience. Perhaps knowing that, we can anticipate a different pathway for them, maybe even to celebrate the resiliency of this class to make that special for them. Likely we're having influx of grateful patients and grateful patient families that obviously that's not our focus now, but there's going to be a high volume. What does that do to our grateful patient programs? How are we planning for that to have an appropriate response? The human services needs may be lasting. The global poverty efforts may backslide. The real progress against the UN goal on extreme poverty has been amazing. What does this do to that when the donors pull back and our ability to travel to some of these places are hampered? There's potential, some have said in the arts and even in religion, I've heard a few mention of potential consolidation. Let's hope that doesn't happen, but the arts are really those that, the types of charities, arts and the religious sector that have gathering of people are having a very difficult time financially. Is there potential for collaboration? I think those are some really valid open questions. But perhaps one of the most important things in your longer term recovery is that we start thinking about ways that we will close the chapter. Now, we definitely can't do this prematurely, but sort of like sometimes people will close a campaign, have a campaign close, really to just make sure everyone knows this campaign's done, to give us permission to move on to what's next. We're going to need to find a rite of passage as humans, a way to, all right, we've done that, we're through that, now we're on to what's next. Ways ceremoniously or otherwise through recovery events. Maybe it's a retrospective publication, a specific thank you gift to employees, maybe even to some donors. Thanks for surviving the great COVID 2020 XYZ or what it might be. But I think it's really important that people find ways to commemorate a pivot socially. And I think that's really important as we've seen in campaign fundraising. So from early, we're focused on urgent needs and immediate continuity with some shift top down on solutioning. In the midterm, we're thinking about maintaining activity with an N of one listening, as Mark pointed out, really listening to the donors where they are so that we can keep moving forward, but so that we're not driving as much as we might otherwise. We're being aggressively reactive. In the later years, planning, our strategic planning for future events, our continuity plans, ways that we can wrap this up and move forward to a business as usual and caring for each other in the community, just like we have right now. Oftentimes, you think about the gifts that happen during a tragedy like a Katrina, and then there's a big fall off the year after. It's important that we all keep this sense of community with our brothers and sisters in the philanthropic sector, even when we're past all of this. So hopefully this was helpful. Mark, please, why don't you jump in?
Yeah, we've got a couple questions stemming out of the comments about planned giving. So there's a couple things that one is if you remember thinking back, we mentioned talking to donors is to be careful about tone. And so one of the challenges when we have a life and death situation for some people, obviously the majority of people will survive COVID-19 just fine. But is coming across it has been perceived by some as coming across as tone deaf. So there's some just real challenges with planned giving. I'd be real thoughtful about the messaging that goes out. And there may be things that you could send out 365 days of the year in a normal year that might come across inappropriate at this time. Really, again, depends on your audience, the tone of the messaging. That's the caution around that. And I know there's been a couple of organizations that have gotten some national press around planned giving mailings that went out completely they were planned, they were timed, just were received poorly by the donor community.
Yeah. And I might add to that, that doesn't mean stop doing planned gift fundraising. It's really in these broad appeals. That's where I think that could be perceived otherwise. When you're one-on-one with a donor, if they want to talk about planned gifts and deferred, please still have that conversation. It's really being sensitive to the donor's perspectives.
Josh, you kind of answered this one in the discussion, but there's a question around discovery work. My personal experience has been this is a great time to do discovery work. We've actually been, we're encouraging people to keep driving ahead with planning studies for the most part. There's been a couple we've suggested on, but we want to really think about, we've had some great feasibility study interviews with people. Donors seem really, right now everybody's locked away in their basements. I'm locked away in my basement. Donors seem interested and excited to talk.
Mm-hmm.
And they're slightly different conversations, but would really encourage you to drive forward 110% on discovery work. Some of the messaging might be different. One of our sessions that was, I want to say last week on digital development officers might be a great just starting point, and again, something we'd be happy to help you with, but discovery work can be very meaningful. And one of the odd outcomes of this whole experience might be people really learning to be flexible with utilizing technology to do that. Josh, any discovery work?
Yeah, a couple things. One is, though we've had some organizations that are increasing their volume considerably right now. I was talking to one charity actually just this morning, where even beyond their fundraising staff, now this is a human services organization, they've got non-fundraising staff joining a queue to do thank you calls while they're at home. They've divided up, and now the thank you calls might not seem as a discovery, but it's a touch point that is serving a really solid discovery message, especially for those donors that haven't had personal communication yet. So, and we're seeing some pretty good response to that discovery calling. It's been real flexible, social, online. It might be a video call, a phone call, or even just a text back and forth. You know, just we're thinking about you. We just want you to know about that. I would continue with qualification efforts, perhaps the same way. It's even more reactive, but really that's what qualification is talking to donors, what drives them, where are they right now. I think those are welcome conversations right now.
Yeah, you'll find that this is an odd opportunity to people. If you think about, people can all say, where were they when the Challenger disaster occurred? Where were they when this event happened, that event happened? This is an opportunity for you to bond with people, and sometimes the meaning of the human experience that we're all going through, and to have that interaction. Having some of those conversations about how are you really matters. When one of our learnings when we have an opportunity to talk to donors about their experience with giving was some people felt hurt when the recession occurred and some organizations stopped talking to them. Mm-hmm. They suddenly stopped hearing from an organization that they cared about. And it's important to make sure that we continue to do, to have those conversations.
Another good idea for some of that qualification discovery work is establishing some cohort-based virtual meetups. So like, let's say you've got, if you're a school, maybe it's a computer science grads are going to do a meetup, and you have a few donors that are part of that, and then you have other prospective donors. You could do that with, I don't know, perhaps even your orchestra. You know, we've got the young patrons group. We're going to do a virtual happy hour and talk about that, where you're strategically choosing cohorts by affinities, including generous donors and as well as prospective donors. They might be willing to join and start to build that community. We've seen again and again in studies the multiplying effect of a donor being friends with other donors. So being a donor to the organization is one level. If this donor is also friends to two other people that are also donors, their lifetime value will double or triple in some cases. So that the power of that community, we can establish community in a virtual environment right now. I think that'd be a real solid strategy.
Yeah, and we are set up in this Zoom environment as a presenter mode, but we've actually been doing some staff training over the last couple of weeks about major gift officer training, coaching through these conversations. And Zoom and other platforms offer you the opportunity to break into small groups And those have proven very valuable from a training perspective and an engagement strategy. So don't be afraid. Technology is going to create some opportunities for us, and necessity will help finish those creations. And I would tell you this is that our non-education and non-healthcare clients, the national and international organizations, tend to use technology more aggressively already. And while we want to be a hands-on sort of industry, we know that there's an opportunity for us.
Mhm.
Josh, I think we're about at the end of our time. We've got a couple more questions coming in, but what we'll do is we'll try and answer those directly. Any closing thoughts, Josh, for the group?
Well, just thank you all for participating in this. It really lifts our spirits that people are listening and also asking us questions and sharing with us. Even if share us your good news, the successes you're having. That is so huge to us to know that we're making a difference, because we know you're making a difference. We're around nonprofits all the time. We see it again and again. It's just so exhilarating to see people in the nonprofit sector. Please do share with us, and so that I can share with my team, Mark share with his team, with our firm, about the great work that you're all doing. It's such a privilege to be part of this community with you. Thanks for joining us.
One
Again,
last wrap up. If you look at the BWF resources here, there is an opportunity for you to kind of review this format and have other people look at it. There's a lot of other great resources out there. I know we have some questions that came in after the fact. We'll be reaching back out to you with answers directly to you.
Excellent. So everyone, be safe, be well, keep doing what you're doing. Take care.
Have a great day.